Hey guys, Greg here with Keto. Today we're talking about heartburn. So, full confession, I've been having some heartburn in the last few days, but I figured out why and I want to share it with you. So if you guys are new around here, we are Keto. We've been doing the keto diet for about 5 to 6 months, depending on who you are, and we cover all kinds of stuff. Day of eating, vlogs, grocery hauls, all that fun stuff, plus a lot more. And we're starting to do a little bit more of the tutorial type stuff, which is what this is. So if you are interested in keto of any sort, you guys are going to want to hit that subscribe button, click the notification bell so that you're updated whenever we put out a new video. Alright, so let's jump into this, guys. So first of all, I am not a doctor, so what I'm going to tell you is basically related to my experiences doing the keto diet for the last 6 months, as well as having acid reflux, GERD, all that wonderful good stuff for the last 15 years. Yes, 15 years. After being on keto for 2 months, I was able to stop taking my everyday medicine, my Prilosec, your Prevacid, your Nexium, those meds. After 2 months on keto, I no longer needed them. But that doesn't mean you're immune to heartburn on keto. You're definitely not immune to heartburn on keto. And there are some things that you can do, especially if you're prone to it, that can reduce your risk of heartburn and all the negatives that go along with that. All right. So first of all, we have two different camps. We have the healthy, fix your acid reflux this way peoples. They're going to tell you that you don't have enough stomach acid. And that's your reason you have heartburn. You don't have enough stomach acid, and so you need to up the acid. You need to increase the pH in your stomach to be able to digest food properly. They're right. We also have the MD side, and the MD side, they say you have too much acid in your stomach, and that is what's causing your issues. And the reason that acid is in your stomach is because of a number of factors. You got stress, you got all these other extra things that can cause these types of things. It's also hereditary in some respects. Sometimes you just produce too much acid. So they prescribe these beta blockers like the Nexium, like the Prilosec, that basically restrict how much acid you're producing. It helps. It gets rid of the symptoms. It doesn't get rid of the cause. These guys are addressing the cause. These guys are addressing the symptoms. They're both right. But there's more. So, as I said, when I was in my 30s, I was overweight, less than I am actually right now. I was about 250 pounds. And 30 hit me like a truck. I was feeling every bit of 30, and going through the 20s, which were a very emotional time for most people. But I also had 4 children, 3 children at the time. The 4th one came after 30, and not a very happy marriage. So it was stressful. Well, I started to develop these symptoms where I was having extreme chest pain. And of course I ignored it at first because, you're like, oh, it's just heartburn, it'll go away. But eventually it kept persisting day and day and day and day, right? And ultimately what ended up happening is it got to the point where it was so bad and so intense that I thought I was having a heart attack, right? And I wasn't sure about it, but then because of the fact that I was thinking I was having a heart attack, I started panicking, which gives heart attack-like symptoms. So I was actually at the office one day working, and I started feeling like this, and it was too much for my brain to compare. And I went to one of my coworkers and I asked him to dial 911, and an ambulance came. They checked me out. They said, you're fine. It was stress. Your blood pressure is really high. So I went to the doctor and I found out that I had really high blood pressure, and I also got diagnosed with GERD and panic disorder, right? Which is pretty much a staple at this point in American society these days, for most people anyway. So they, of course, subscribed blood pressure medicine, antacids, I think Nexium at the time. And then I also got in some Zoloft for my anxiety. And it was okay, right? So I was resuming my years at 30. And I basically proceeded to do that all the way to now I'm 44. And up until I started keto, I've pretty much been taking those religiously, doing everything I was doing, but feeling miserable at the same time. Now, if you've come to us from our keto channel, then you're going to know a lot of the following already. But if you're new, stick around. So now let's talk about present day. So within a couple months on keto, I was able to get off of my blood pressure medicine, my heartburn medicine, and my anxiety medicine, because they were kind of all clumped together, right? And I'm feeling great. Within the last few weeks, though, I have been having some heartburn, and I wasn't really sure why. Like, why is it coming back all of a sudden? Well, heartburn has a huge trigger in caffeine. Now, if you've been following us along, you'll know that Stacy and I were both very excited to find this Bang stuff at Walmart. And it has a tremendous amount of caffeine. It's an energy drink. Well, if you're also following a keto diet, you're also probably following intermittent fasting, which I do. I do an 18-6 intermittent fasting routine. I do it generally 3 or 4 times a week. I try to give myself a little bit of reprieve on a couple days, just so that my body doesn't fully adapt to that way of eating. Otherwise, I'm going to have to start pushing it more and more. But that's not what we're talking about. So anyway, these are really good, and they're also keto friendly. The problem is they're not intermittent fasted friendly, and let me explain to you why. So the reason that I've been having heartburn is because of caffeine. Now, caffeine has a very unique effect on heartburn. It actually there's a gland that's in your esophagus, the bottom of your esophagus, that closes, right? And it closes, but it is weakened from caffeine and nicotine and alcohol. Like, those are the 3 things that really make this thing not function like 100%. Well, I tried to draw a conclusion as to why I'm having heartburn, and this is what I came up with. So in the morning, I generally have a cup of black coffee, right? Keeping my fast. But because these are good and keto friendly with no sugar, I would sometimes have one for lunch. Well, my lunch sometimes doesn't happen until 2 o'clock. So if I'm consuming this much caffeine that late in the day, it has some negative effects on me, guys. It has probably some negative effects on you too. That's why I'm making this video. Is if you're taking caffeine, so caffeine itself is supposed to help a lot with intermittent fasting, which is good. But this is going to break a fast. It's got sucralose in it. So people can drink these in the morning as a replacement to coffee. But this is likely going to break your fast. I don't know for 100%, but based on everything that I've read and research I've done, this is likely going to break your fast. And there's a lot of benefits from fasting, and I'll maybe make another video on that. But there's some other resources out there that can talk about that. But if that breaks my fast, I don't want it, right? I'll stick with my black coffee, which I know doesn't break my fast. I'll get that caffeine, and then I'll just not have that. Because drinking that 2 or 3 o'clock in the afternoon, it kept that caffeine in my system all day, evening, and that caused my gland to weaken. And causing my gland to weaken caused heartburn. And so, of course, I attempted to treat it, right? I did the cocktail, the apple cider vinegar, the lemon juice, diluted it in tea, water, whatever. And it helps to an extent. The problem is that if this increases the intensity of my acid in my stomach, and this weakens the gland, you see what I'm saying? That's not a good combination. Because if that weakens the gland and this makes my acid more intense in my stomach, getting rid of the heartburn, it's still going to cause those splashes to come up and hit my esophagus, which is what you want to avoid, right? So, yeah. So caffeine after 2 o'clock, no good for me. Not doing it anymore. So that's just kind of my take on how this kind of transpires. Problem is that if this is something you absolutely have to need, then you're probably going to have to follow the traditional doctor's advice, and you're probably going to have to try to reduce the amount of acid in your stomach. The problem with that is, if you're like me, those types of things, reducing the acid in your stomach, means you're not digesting your nutrients properly. It means you're not processing your food correctly. Even if you're doing a healthy ketogenic lifestyle, you're likely to have issues with IBS, diarrhea, all that other stuff. That was the problem that I had. Is not only was I having issues with caffeine too late in the day, causing my additional GERD, processed foods. There's a whole other piece on that. But I just thought that this was something that I would share with you guys, because this is something that I kind of had as an epiphany in the last few days. So I was treating myself with this, but it was still causing me issues. I thought I actually gave myself an ulcer because the acid was so intense that after consuming it, it caused more issues than good, because the acid was okay. The problem is the caffeine was getting my valve, and that was what's causing my additional issues. What's happening now? Well, so the last few days, I've stayed off the bang completely. I've actually even cut coffee out for the last few days because I know caffeine has that impact. And after a couple days, I'll make one of these concoctions pretty much about 30 minutes before I eat. So I'll do this with a little water, and I'll get this down, and then I'll eat whatever I'm going to eat. Now, I eat spicy foods. I love spicy foods. I haven't really steered away from spicy foods. The last few days I have. But generally no. And I'll do these. I'll get these together, and then I'll eat. And you want to try to drink your water or whatever you're drinking after you eat, because otherwise it will reduce the intensity of the acid in your stomach, and then it will process your nutrients. So give it a little bit of time. Some people need to drink when they're eating, and that's fine. It's just, this is one of those things. Now, I can do a whole other video on acid or IBS. I had a huge issue with IBS, but that's another video. So if that's something you guys are interested in hearing about, my journey with IBS and how I've sort of combated it and overcome that as well, doing the keto diet, let me know. Leave me a comment below, and I'll be happy to share my story on that. It's not a pretty story, but it is a story nonetheless, and I think there's a lot of benefit out there for it, if you guys are interested. But it's a shitty story, no pun intended. I just wanted to share this with you because I felt that it was worth repeating. Like I said, there's keto evangelists out there that are talking about how awesome apple cider vinegar and lemon juice are, and how they really help your digestion and fix your acid. But then there's also this wild card, and if you incorporate too much caffeine into your diet, especially too late in the day, it's going to prolong your agony all day long. You want to, if you're going to do caffeine, which caffeine, like I said, is good for intermittent fasting, do it in the morning, and make sure that it's completely out of your system, at least a good portion of the day. Probably while you're still processing your food, because if you over-caffeinate yourself and you loosen that gland, you will end up with some splash up, and it's not pleasant, guys. It's so not pleasant, and you don't want that. Now, I'll tell you right now, through the course of the last 15 years in dealing with GERD, acid reflux, I did a lot of things. So I was sleeping on wedge pillows. I would have a mask. I was pretty good about not eating past, giving myself 2 hours before bedtime before I finished eating. So I'll be done eating at 8 o'clock. I go to bed at 10 o'clock, and that generally worked. There are a couple times where I might have gotten a little inebriated or something, and that's just so not pleasant. So not pleasant. Having that stuff come up in your, it's the worst, guys. It burns the whole time. So yeah, I did I did pillows. I've done the wedge pillow. You've seen the wedge pillows. I've done those. I've also done that because of snoring and sleep apnea. So I mean, there's a lot of different things that kind of all kind of equate into that situation. But if you want to beat acid reflux, if you want to get off your antacids, and you want to live a better, healthier life with a better quality of life, I gotta push the keto diet, because I've already lost 80 pounds in the last 5.5 months, and I've been feeling fantastic outside of the heartburn. Well, that's it. Hopefully you found this video helpful. If you did, please give it a like. If you're not a subscriber, please consider doing so. Stacy and I have a weekly journey we talk about since she started keto. We've been tracking her and my progress. It's the Carboholic series. So we have that. We also have some cooking recipes and some other videos. Barbecue is a big passion of mine, so doing keto barbecue is really important, which oftentimes barbecue is very sugary. So I've been figuring out how to cut out the sugar and still make some really good barbecue. So you want to check out my pulled pork recipe, my rib recipe, stuff like that. So, alright. Thanks for watching. Thanks for subscribing, and stay keto.